Hi, this is Andrea Kane with HAT 352 Health Information Systems. We are now on week 10, and that is chapter 10, Consumer Informatics. If you look at your syllabus, you will see that we are on course objectives still of 8.2, 8.3, and 8.4. And those correspond to our learning objectives 9.1.2 through 9.2.7 and 9.3.1 through 9.3.3 and 9.4.1 through 9.4.7. And if you want to see what the specifics are, take a look at your syllabus again for that information. But moving on, according to our book, this is what our learning objectives for this chapter will be. They want to help us understand what consumer informatics are, differentiate between a patient portal and a personal health record because they are two different things, and explain the impact of health literacy on patients. So let's talk about how patients use technology for their health. It is a way that they can keep in touch with their healthcare providers as well as access health information. And this is one of those things that actually held true for me. I recently had two kids and they had strep throat about 3 days apart. And in order for them to go back to school, they had to have a doctor's note releasing them back to school. And so I used the technology, the patient portal that was available for their doctor to be able to request that letter of return to school. And then the doctor put the letter in there, and I was able to go in, pick it up, print it out, and then they could take it back to school for the office to have on file. So yes, it's technology we use for our health as patients or patient family members. Health literacy. If you have never really gone into the topic of health literacy, then I think it's really important that you do so now. If you are interested in going beyond this tiny definition, let me know because I'm teaching medical terminology as well right now. And I have an assignment, a discussion actually on health literacy. And it really helps people understand as they're going through and learning about medical terminology, the importance of health literacy as well as cultural competence. But I digress, sorry. So the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions is what health literacy is. And people have different varying levels of health literacy. And if someone is health illiterate, they may feel very uncomfortable about asking questions about their care, about clarifying, when do I take this medication? What do I take it with? What don't I take it with? And those types of things. So it's important to understand health literacy when you're talking about consumer informatics because you want the way that you communicate with patients to be able to be understood. There is a national action plan about health literacy to try and improve health information and communication, incorporate health information in schools, and support adult education programs. I really wish that every high schooler was required to take medical terminology because I think it just really helps them understand themselves and their health and the way that it would be communicated so that they could advocate for themselves and others who are not health literate. I just see that as being, that's one of the things I get in feedback from my high school med term students is how much it has really helped them open conversations with other family members who may not be health literate to talk about how can they improve their health literacy and how do they feel when they go to the doctor and they have a question. Are they comfortable if they're not health literate in asking the question? They also want to be able to conduct research, use evidence-based practices, and have goals. So you can look up the National Action Plan, and I would encourage you to do that. Health literacy includes understanding prescriptions, discharge instructions, consent forms, and appointment scheduling, as well as requests for information, navigating healthcare, and the ability just plain to understand the terms that are being used and the processes that are in place for healthcare. Some contributing factors to health literacy or illiteracy is communication skills. You notice this sometimes with people when English is a second language for them, and that can be true of the provider. Maybe English is not his or her first language, and it may be difficult to understand if they have a very heavy accent. It can also be, on the other hand, someone who struggles with communication as a patient, whether English is their first or second language, or whether they just struggle to be able to describe their thoughts, feelings, and be able to speak the questions that they have to get the answers they need. Knowledge of healthcare absolutely can be a contributing factor to whether or not someone is health literate or not. People who understand healthcare and how it works and its terminology and the processes and the different types of caregivers and care settings are usually much more health literate than others. Culture can be a contributing factor in terms of someone's health literacy or illiteracy. Some cultures discourage healthcare, reaching out for healthcare, and so or understanding anatomy and physiology, or studying different diseases or things like that. There are demands on healthcare facilities, and time is of the essence, and sometimes providers have to stop, take a breath, and make sure that they're assessing the health literacy of the patient before they start explaining what they need to communicate, so that they make sure they're doing it in a respectful way and in a way that meets the patient or the patient's family where they are in terms of their level of health literacy. Sometimes people who are older than 65 struggle with health literacy. Maybe they have been taught from as a child, you don't question the doctor, or you just figure it out yourself, and that can impact the ability for health literacy to take place. Sometimes people who are of different ethnicity backgrounds can struggle with health literacy, especially if they're a recent immigrant. Sometimes if they're at or below the poverty level. Again, I mentioned English as a second language. Those are all contributing factors to challenges with health literacy. So what are some ways that you can reach out and improve health literacy? Well, there's always resources. There's magazines, other news sources, marketing, family, friends, websites, commercials. Really encourage you to go out to the government's websites on health literacy and take a look at those, whether that's the CDC or Health and Human Services, because there's a lot of good information out there about that. Just be careful if you're using the internet and a non-governmental or non-respected healthcare website. For instance, a Mayo Clinic website is probably going to be fairly trustworthy, pretty trustworthy, whereas People Magazine may not be, or the New York Times may not be. So just be careful. There are varying degrees of quality of information out there. Jargon. Sometimes people use euphemisms, jargons, slang, those types of things, and that gets in the way of health literacy. It's just so important to ensure understanding, to ask them to tell you in their own words what they thought they heard you say. It's called teach back. Make sure that you are familiar with teach back and what that means, and how that can ensure patient understanding, especially in health illiteracy situations. There are ways that you can use pictures. I just talked about Teach Back, and then Ask Me 3 initiative. The Ask Me 3 initiative is asking questions, and those are all really good ways that you can help someone improve their health literacy, especially when you're communicating about something specific. Consumer health applications. There are all sorts of healthcare technologies out there for smartphones, apps, tablets, computers, smartwatches, all sorts of things. These can access health information, encourage healthy lifestyle, track all sorts of different things, manage conditions, and access a personal health record. Healthcare providers use consumer health applications to access patient information, communicate, monitor patients, also telemedicine. Technology that's used for remote patient care monitoring is called telehealth. And it can be video conferencing, using the internet, using store and forward imaging, using streaming media or communications. And your book does a really good job of going through these different things, so I'm going to refer you back to there. Telemedicine is a subset of telehealth, and the focus there is on patient care. Telehealth is a broad term because telehealth includes telesurgery, telemedicine, telepsychiatry, robotics, all sorts of things. Telemedicine is a more specific, that's really looking at sort of like electronic primary care visits. So just watch out for the different terms that are used. Some benefits of telehealth. If you do e-visits, this gives you some of those. I would challenge on approved efficiency. I went through this with my son. I used a telehealth visit for him when he had strep. And so he interacted with the physician over the computer through sort of like a Zoom feature. But then we had to turn around and drive to the doctor's office the very next day and get a parking lot strep test swab in the parking lot. And so I would challenge that there's not always improved efficiency. And not always reduced cost. I mean, there can be. A good example might be that someone has been seeing a psychiatrist maybe in Cedar Rapids. And with all of this, they now do an e-visit with their psychiatrist. So they're doing telepsychiatry. So that would reduce travel and that would help the patient be able to still get good care, just maybe, but at a cost savings and a time savings. And so here are some more as well. Disadvantages. The funding for telehealth has not kept up with its advancements, and that's one of the things that COVID has done is it's really brought telehealth to the forefront, and payers and reimbursement systems have really been scrambling to improve the reimbursement that comes with telehealth, with the coding, billing, and reimbursement that comes with that. So hopefully that's being addressed. Consumer engagement is a term that is often used with consumer informatics, and it really means, according to this, it means a diverse set of activities that can include interacting with healthcare providers, seeking health information, maintaining a PHR, and playing an active role in making decisions in regard to personal health care. And I think that's a very good definition. And consumer engagement is one of the things that is managed by Meaningful Use and some of the other government EHR implementation incentives. They're looking to see, is there communication, is there activity between the patient and the provider? They know that providers are interacting with patients and they do want to see that as well. And consumer engagement can mean that you send out a message as a provider about use of sunscreen in the spring, reminding people how important it is to use sunscreen. It can also be in the fall, reminding patients to go get a flu shot. And then the patients can follow up by, is there a communication back saying, when are you giving flu shots? Can I just drop in or do I need to make an appointment? And you can follow that up with, okay, we sent out the message about flu shots September 1st. And then you can measure how many patients receive that message versus how many receive flu shots. And so it can theoretically have some kind of engagement there. So that's definitely something that still is being looked at. And this gives benefits, talks about the Blue Button campaign and population health, and I'm going to refer you back to your book for those. And Blue Button campaign you can look up online as well. Patient portals. Again, I think I talked about that a patient portal is different than a personal health record. And I can't remember if it is this class or another class that I had looking that up and doing something with. I think it might have been this class, but they sometimes blur together, and I apologize for that. Oh, it was this class, week 2. Do you remember where you talked about patient portals and they're different than health information exchanges? Well, patient portals are also a little bit different than PHRs, and so you'll want to make sure that you understand the differences. And here's some of the things that a patient portal can do. Benefits of the patient portal, types of patient portals, and then personal health records. This talks about those and what they are and what they include, and what they include again. Talks about formats. And now we're on to social media. Oh, social media, that double-edged sword. It can do so many good things, it can do so many bad things. You think about the bullying that sometimes happens on social media, and that's terrible. And then you think about some of the ways that it really educates people, can promote wellness, can get people communicating about some positive things. And so, yeah, it goes both ways. But this talks about how social media is used by healthcare. A lot of healthcare organizations have Facebook pages where they put information out to the community about different activities that they're having, such as a flu shot drive or physicals for school kids when they're going back in the fall that they want to play sports. So they can talk about classes they're going to have, those types of things. And so these are some more benefits. And I'll refer you back to your book again if you want to take more look at this all in more detail. And then there's references here that they had given us in our slides. So that is it for chapter 10 on consumer informatics. And so you will have this week a discussion on consumer engagement, an assignment on telehealth and consumer health applications, an assignment on health literacy and cultural competence. That one's really, really important because that is one of the ways we're going to assess what you're learning in this class. So that's why that one is in bold on your syllabus. And then you'll have a quiz over chapter 10. So I hope you have a great week. And next week when we come back, we will be focusing on health information exchanges. So stay tuned. Take care, and I will talk to you next week.